Hello, my name is Beth Govero, Chief Nursing Officer here at Cleveland Clinic Abu Dhabi Hospital. And we would like to wish every nurse a happy Nurses Week. And I'm honored to be a part of this podcast this week with two of our shared governance chairs here at Cleveland Clinic Abu Dhabi. And I'm going to go ahead and let them introduce themselves before we get started, sharing about the shared governance journey here and what they think about shared governance and how it has impacted them as nurses and our patients.
Hello, hi everyone. My name is Queen Falawiyo. I'm a charge nurse here at Cleveland Clinic in the Neurology Institute, and I'm the chair for the Ambulatory Coordinating Council.
Hi, happy Nurses Week, everyone. I'm John Raymond Rubio. I'm the charge nurse of the endoscopy department and currently the chair for the Perioperative Services Coordinating Council.
Excellent. Well, thank you for being on this week's podcast. I think just to start, why don't we share what shared governance is here at our hospital and what it means to you?
I can go first. So shared governance is a collaboration of where nurses come together to make decisions that can impact their workflow as well as patient outcome. And what it means to me as a nurse is that I have the opportunity to be involved in decision making in my unit as well as in the organization as a whole. Yeah.
Well, for me, shared governance, as we all know, it's a magnet pillar, wherein the frontliners are the voices. We are the change makers here. So, Queen has already said, other meanings of shared governance. But for me, shared governance is where we speak up when we want change. Yeah.
Excellent. So what has been the most challenging about leading a shared governance council?
Well, for me, one of the challenges in leading a coordinating council is that sometimes people are just tired from their clinical duties. However, we have our leaders and other members of the team that will engage them, to perform and bring out quality improvements and change that they want in their department.
Mm-hmm. Excellent.
Yeah, and for me, one of the challenges will probably be trying to get people to be as engaged as we could be. However, we are working on that. We recently did like a UBC youth boot camp for just our chairs in the ambulatory council. And that way they were able to identify what they would like to see more within our council. Mm-hmm. And so far, we also celebrated like our first ever ambulatory Nurses Week. So that also kind of fostered like an engagement as well. So I think engagement was, an aspect, like an area that we are trying to improve on. Mm-hmm. It's been better so far.
Good, good. Well, it's to your leadership and how you've really engaged your peers to be a part of this process.
Sure.
And hopefully filling their cup up while making sure patients are well taken care of. John, you and Queen, we have our Nurse Executive Council that meets every other month, where each of our shared governance councils report out their quality metrics, their projects that they're working on. We discuss where we do really well, where are some opportunities, and then what can nursing leadership here do to support. I know, John, you've been working with your Shared Governance Council and Periop on patient experience.
Sure.
Can you share what you guys have been working on and how successful it's been, and just how engaged the members are to get patient experience and really great scores?
Well, I'm excited to share, the perioperative services have been really engaged in working on our patient experience score. Well, in fact, at the end of the year of 2023, we met our target for patient experience, friendliness of nurses. And of course, even meeting the target, we don't stop there. So right now, I'm happy to announce that the shared governance of the Periop Services Department worked on the SMS Journey project, wherein the significant other of patients will be receiving updates through SMS. So that will really improve and make the stay of our patients more valuable here at the Cleveland Clinic Abu Dhabi.
Excellent. Yeah, great work by you and the
Thank
team
you.
and doing something innovative. You know, utilizing Epic and enhancing that. So really, you know, working with other departments. It's not just nursing that, you know, necessarily does the work, but really pulling in the multidisciplinary team to work on these projects. So Queen, what are something that the ambulatory clinics have been working on that you're really proud of?
Sure. I'm actually excited for this one. This is the TV screen utilization. This is something we're working on in terms of like not just making decisions within the nurses, but also involving patients. So this is a way of us trying to get information out to patients. For instance, like we have issues with patients coming in and forgetting their medications at home. So we would use this TV screens utilization to, you know, inform patients about awareness of things like stroke education, of falls, medication awareness, as well as, you know, the application for the mobile app to let them know that you know, it's such an amazing app. However, some patients are not aware of how to utilize them. So this is something that we're working on to get patients also involved as well in, you know, decision making that was done within our council to you know, impact patient experience.
Excellent, great work. I love the patient focus. And we also want Cleveland Clinic Abu Dhabi to feel like home to our caregivers. So share how shared governance has helped develop you as a nurse, and then how does shared governance also benefit our caregivers in regards to development?
You know, for me, shared governance has helped me hone my leadership skills. You know, I'm managing 12 unit-based councils under the coordinating council, and it takes a lot of effort, conscious effort to manage all those, a lot of follow-ups. I think shared governance can, you know, enhance your leadership skills if you want to go up the ladder in your organization. And of course, you know, being in the coordinating council or being in the shared governance will bring a lot of opportunities for you.
Great, good.
Absolutely. I agree with what Erm said. You know, when you are the chair, you are the voice of all your colleagues within your council. And for me, it's always been something that I'm passionate about, to be able to speak up for those of my colleagues that perhaps, you know, are more reserved or more shy. And also for leadership skills, also as like a charge nurse, this also kind of like helps me in terms of like collaboration within other nurses. Like I never met Ron prior to me becoming like a chair. So this is also giving me that opportunity to get to meet other nurses within the organization. Like it's such a big hospital and we don't get to see each other. However, through shared governance, I've had the opportunity to make new friends as well. So yeah, that's been great.
It's that teamwork, especially when our patients see, you know, their physicians and nurses in the clinic, and then they go for a procedure. That teamwork just really helps solidify that process and handoff and safety of our patients and our caregivers. So what advice would you give someone if they were to want to start a shared governance council in their unit or in another hospital, since you guys are excellent pros at shared governance?
Go ahead.
For me, I would say, you know, definitely go for it. It's an amazing experience. So far, even in terms of like confidence building for the caregivers, this is a way of them to get involved in decision making. So absolutely go for it, do it. Even like I have colleagues coming to me and asking me like, oh, how do you feel about being the chair? Is it something that, you know, you would recommend to me if I'm interested? And I'm like, yes, absolutely, do it. You know, it's improved even for me in terms of confidence as well. Like I've enjoyed having to run meetings. I've enjoyed having to, you know, engage more and be more involved in decision making. So yeah.
I mean, if you want to have a shared governance council in your hospital or in your organization, have a buy-in that if you want to have something change in your area, this is a great model to start with. You know, make sure that we have that engagement amongst your team and things to work on. Yeah.
Good. Well, with being Nurses Week, our shared governance and coordinating councils really make this week successful, and I think really make our nurses feel appreciative. So what can you share are a few plans that you have in your areas this week for our celebrations?
Well, for PairUp, we'll be having unit-based activities, games all throughout the week. We also have a road show tomorrow, which is Wednesday, where our CNOU, Beth, will be meeting our team.
Sure will.
And we will be having a talent show as well and a baking cook-off on Friday.
Oh,
Yeah.
I definitely need to get to the cook-off. Yes.
Yeah, we're happy to have you there.
Are you making anything?
Not me personally, but some of my team.
Okay, great.
So on an organization level wise, yesterday we had the pleasure of having you come for the road show.
So special.
Yeah, it was really nice to see you engage with all the nurses. Afterwards, I had great feedbacks. They were all like, oh my God, that was nice. And yeah, so as well as unit-based levels, we would have like games. Like so far during the huddles, we've been having games and we have prizes for the nurses to be won. And also we have talent show, which has been an amazing way, by the way, of collaboration. Like I see the nurses getting together, you know, working on making their video just to have it submitted on time. So that's been nice as well to have them engaged. And on Friday, we'll have the Shared Governance Award, where we will be recognizing and appreciating unit-based council members.
Oh, yeah.
Yeah, so, yeah.
Lots of great activities planned this week. You know, thank you for being here. Thank you for having me participate in the Nurses Week activities with your shared governance, because truly this hospital's backbone is our nurses, and our shared governance councils are the voice. They make changes, they advocate for our patients and our caregivers, and we could not do what we do without you. And so from the bottom of my heart, I just want to thank every nurse that puts in the time and the dedication and compassion for patients globally. And a special thanks to our shared governance councils for the work that they do here for our hospital and the community. Thank you.